Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Acute pancreatitis, and we're looking at the clinical features. So in terms of acute pancreatitis clinical features, first we look at the symptoms. So under symptoms, it is the acute onset of the epigastric pain. There is acute onset. And this is of the epigastric pain. Epigastric pain. And it can be severe, constant and refractory. So it can be severe. Next, it can be constant and it can be refractory. And this is to the usual doses of the analgesic, to the usual analgesic doses. Next is we need to know that it radiates to the back. So typically it radiates to the back and it is relieved in the sitting forward position. It is relieved. So it is relieved by sitting forward. By sitting forward, it is relieved. And there is also the nausea and repeated vomiting and retching and hiccups. There is presence of nausea, there is a repeated vomiting. There is nausea, there is repeated vomiting as well as retching. And the presence of hiccups. Next, we move on to the signs. So what are the signs? Signs is there is presence of hypotension. So there is hypertension. Then comes the presence of the tachycardia. So there is hypotension, there is tachycardia as well as the tachypnea. Then we look at the Gray Turner sign. So what is the Gray Turner sign? So in terms of Gray Turner sign, that is A, here it is a bluish discoloration of the flanks. So there is bluish discoloration, and this is nothing but of the flanks. Next we move on to the Cullen sign. So what is the Cullen sign? Cullen sign is nothing but a bluish discoloration around the umbilicus. So it is bluish around umbilicus. So bluish around umbilicus is the Cullen sign. Next we move on to the Fox sign. So what is meant by Fox sign? So here in Fox sign, it is a discoloration below the inguinal ligament. So Fox sign means the discoloration below the inguinal ligament. There is discoloration and this will be below the inguinal ligament. Below inguinal ligament. Next we move on to the pleural effusion. So in terms of pleural effusion, the left is greater than the right and there is dullness on percussion. There is presence of the dullness. So dullness is present on the percussion and there is presence of the decreased BS, that is the breath sounds. To learn and grow daily like this, please do subscribe.